Thank you so much for joining today for this chat. My name is Daniela Varano and I'm based at the ACT Alliance Secretariat in Geneva. This is the first of a series of discussions to better understand the effects of this pandemic on the different issues we're working on. COVID-19 is not just a public health emergency, but is also a humanitarian emergency. It is a food security emergency. It affects refugee and migrants. And of course, it's a big challenge for women, gender justice and equality. ACT Alliance has launched a global appeal, which aims at establishing a locally led response to tackle different sides of this crisis. And we're here to understand a bit more of what is our response, what it entails, and what we should take into account. I'm here with Silje Heitmann from Norwegian Church Aid and Laura Chacon from CREAS. I would like to begin this conversation with us reflecting on how this pandemic is affecting your work and in the context you're working in, and what challenges do you see ahead of us? And welcome. Silje, would you like to start?
Thank you so much, Daniela. Thank you for inviting us to this conversation for ACT Alliance in regards of COVID-19. So my name is Silje Heitmann from Norwegian Church Aid in Oslo. Here in Oslo now, actually, we're starting to have summer, and as you can all see, we are at our homes. We have left the office environments, which of course means that we need to have access to internet. And when we know that over 430 million women don't actually own a telephone, a normal old telephone, that also has a severe impact of how we're working. So yes, we can sit here in Oslo or in Geneva and have perfect internet lines, telephones available, equipment available that makes me able to speak to you guys. But it is important to remember that the technology that we are now taking for granted is not there for over 430 million women. And if we then look at the adolescent girls, for example, it's even less likely that they will have access to telephones or other equipment to be able to speak when they are isolated and facing curfews.
Yeah, digital. You raise a very good point. The digital gap is a big issue, and also in terms of raising awareness, is a very, very big issue. So in our response, we should take that into account for sure. Laura, you are in Argentina now. How is it for you over there? You need to unmute yourself, I think.
Yeah. No. Hello.
Yeah. Hello.
Greetings, so everyone. Thank you, Daniela, for inviting me to take part in this conversation. Yes, I apart from the Regional Ecomedical and Advisory and Service Center based in Argentina, which is as well a member of ACT Alliance, of course. And I am part of the Gender ACT community, Gender Justice Community of Practice from ACT Alliance as well. And here in Argentina, and I would say that in the rest of Latin America, the numbers are not that high that you have in Europe and in other, even in Asia as well. But we are taking the governments are taking the preventive measures, and I think it helps a lot to stop the spreading of the virus. Yeah. So yeah, I think we are trying to help people to care themselves in their homes as well through some channels, for example, internet and online assistance. But most of us, we are at home and taking ourselves as well.
Yeah. And this, like you were telling me that in Argentina is okay, but in the rest of Latin America, it will be a little bit more challenging, and is a wave that we have to expect and prepare for. Yeah. But it's also, of course, this pandemic is affecting different kind of contexts. As I mentioned before, it's not just a public health emergency, but it's like a humanitarian emergency. And it affects every issues we are working on, from the digital gap to food security. But it has a special meaning for gender equality, and that's why we're here to discuss this. I have a question for you, Laura. You know, traditionally, women still do more caretaking. So when the virus closes the schools, it restricts travels and also working opportunities, and puts, you know, the elderly in a fragile state, women have more to do. And this could impact not just the work of today, because we know that there are many daily workers, daily wage workers, but also the future economic opportunities. What are the challenges you see there, and how can we design an effective response, especially in communities?
Firstly, I would like to say that it is important to mention that before the COVID pandemic-19, a care crisis has already been evident in Latin America. So this is an important thing to have in mind. So this reality was really deep and low. It was exacerbated with the preventive isolation measures for this coronavirus. So this situation has generated not only a health crisis, as everybody knows, but also a greater economic and care crisis. So as you say, the closing of the schools, centers, and other fabrics and workplaces suppose that people must provide 24 hours a day of attention to the childhood and to other population like elderly population. So this overloads family time, and in particular that of woman time, who is in the region dedicate days to domestic work and unpaid care work. Triple the time more than men spend on the same task. So this crisis evident highlights an unfair social organization of care in Latin America and the Caribbean, of course, and at the same time it has shown as never before the importance of the care for the sustainability of life. So this is what United Nations has shown in their figures and reportings. So this is a really important thing to say, because the sustainability of life is most provided by women, you know. So and just to clarify that the care work includes the production of different the thing, goods and service essentials for life, like the food preparation, like physical and emotional support tasks, the transmission of the knowledge and values, and to support people to guarantee your well-being in general. So mainly these works are tasks like healthcare, that includes nursing and clinical work, and it's important to say that 90% of the nurses in the world are women, according to the reportings. And education is another task related to the care working, and is related to the work that the teachers do, and the take care that they do for children, or they take the children during the school hours, and of course the caring of the elderly people. So, and there is another one which is not it's important because they have an important impact because of this pandemic, and is the domestic workers as well. So yes, as we mentioned before, even though some of the governments in the region have taken measures to sustain the existing care systems, which are not strong, the care systems are really fragile, and even though the governments are trying to provide financial aid, especially in this country, where crisis is based and where crisis is working as well, we can see that social and community organizations are still struggling to survive in this emergency. So because of the fragile care systems, as I said before, but as well because the aids are not being enough. People are starving and are overwhelmed in carrying carrying work, and it's being a really difficult situation for them. The community canteens are not coping with food needs, and also they need training to prepare food in the necessary sanitary conditions. And on the other hand, the community gardens are asking for resources to supply offline education because, as you mentioned before, the technologies are not available for everyone, and especially for in poorest zones on the cities and on the countries, abroad the countries.
It's very interesting because you highlight two things that I think is really important. The first one is like a pandemic like this highlights the frailties of a system, so make them so evident. The emperor is naked in a sense. And the second one, that's the jobs that we taken for granted that are mainly done by women are so vital at the moment, and we should put more effort and more actually care into this line of works. But this another what I call an epidemic has been highlighted in this time, and I would like to ask a question to Cecilia, because we call normally gender-based violence an epidemic, yeah. And today we're assisting in different countries to an increase of domestic and partner violence. For instance, Chinese activists report that during the quarantine, the number of domestic violence, numbers related to domestic violence increased dramatically. What do you think it might be the broader impact of gender-based violence, and what do we need to put in place as mechanisms and awareness to avoid it or to ease it? Or, yeah, Celia.
Yeah, it's interesting because, of course, when you're facing curfews and you're facing isolations within your houses, a lot of women and girls and children in general are facing more violent situations at home. As you said, we've seen it in China, but we've also heard it in countries like France, Malaysia, Australia, and latest now we're hearing from our partners in Pakistan and in Iraq that the rise in domestic violence and intimate partner violence is really, really increasing. We are seeing that not only can women no longer go out, so they're not just locked down situations that we are all facing, but also locked up in a way inside houses that are violent. We see that it's very difficult to find ways of supporting those that are sitting at home with violent husbands or other family members. It's not always the spouse that is the violent. It could also be someone else that's living within the same household. And we are seeing that the means that we've had so far has been through telephone or through WhatsApp groups, through other kind of technology-based interventions. But we are seeing as well, as I said earlier, that since not all women have telephones, like how can we create the old-fashioned phone booths where we can set up structures where women and girls can go and use phones if they don't own a phone themselves? Or how can we learn from, for example, Spain and France that are using small notes and signs and use of the color of clothes with the pharmacies or the health centers to notify that they're at risk of violence without actually having to speak the word? And how can we train shopkeepers to do very quiet and confidential referrals to services or to provide information to those women and girls where they can go to get support? But one thing is related to intimate partner violence and violence within the homes, but we also see that these kind of pandemics lead to increased exchange of sex for food, sex for services, because women and girls are vulnerable. They're more vulnerable now than they were before the pandemic, and they might have lost their livelihoods through they're not able to sell vegetables anymore at market spaces or other kind of domestic work that Laura also talked about. Unpaid care work, the health centers are closing down or they're contained with COVID themselves. And we saw it during the Ebola crisis in West Africa and in Congo as well, that actually these kind of health pandemics can also lead to increased forced prostitution, and not just forced prostitution, but also increased human trafficking. People are desperate for money to survive, to feed not that just themselves, but also their families, and they believe that the human traffickers can help them to better lives and to work in other countries. And then, of course, you have the other effects, like schools are closing down. So girls and boys have to return to their homes. Very often we see that schools is somehow a preventive measure for both child marriage and child labor and other forms of harmful practices. And of course, closing down the schools, you've not just sent the girls home, but you've also sort of removed girls and boys, adolescents, from another network of teachers, of caregivers that they can meet in school situations. When girls return from school and they can't go back, we often see an increase in child marriages, forced marriages, because people don't have enough money to keep all the children within the family, and then often it is the girls that first are forced into marriage. And then, of course, there are other effects. Research coming from World Health Organization that shows that a boy child is more likely to be taken to the health center for health support if he gets sick compared to a girl child. So how is that then affecting not just their access to survival means within the health facility, but also vaccinations later on when it comes? We've seen in other kind of hunger situations that the boy child gets the most nutritious food and the girl child gets less of the nutritious food. So the implications for gender disparity and increased gender inequality is large, not just related to violence, but also related to lack of education, access to technology, food, and actual health care.
It's interesting because violence can take many forms. And so we need to be aware of that and maybe learn from each other. Like you mentioned Spain and other France to use that they use creative ways for women to call for help when they don't access a phone. So maybe we should learn and translate these measures into our programming, for example. But you also mentioned the Ebola crisis, and Laura before mentioned that how local communities are struggling for lack of funding, and this is going to become a problem. It's already becoming a problem, because in a crisis like this, donor funding and programs can also, of course, be affected, and this could impact women's rights. For instance, resources for reproductive and health rights can be diverted to the emergency response, contributing to a rise in maternal mortality and affect women's rights even more in the future. And we learned from the Ebola crisis, this is not just an assumption, this happens. So what are the main concerns that, aside from the one you mentioned, Celia, that we see, and how can we advocate for donors to understand, first, that local communities are key in addressing this crisis, and second, that there are the funding for this crisis is not just a health crisis, it's a humanitarian crisis, must be kept in place. It's a question for the two of you. You want to start, Laura?
Okay. Yes, as you say, this crisis is a multidimensional crisis. So as we have discussing, it's economical, a health, and a care crisis. So that means that we to mobilize the cooperation of the FBOs, even the FBOs cooperation. Mm-hmm. So we need to take in account all these dimensions. Mm-hmm. And we in Korea we have seen that we can contribute to increase the capacity of governments as well to respond to this caretaking crisis and economic and multidimensional crisis. So at CREAS we have seen the urgent to increase this support, following some lines that we think strengthen the capacities of the communities in the middle of this economic crisis that has been generated because of the isolation measures. Mm-hmm. So things like support the food security mechanisms that the government has already active. So we think that we can, as ABOs, we can support that. Mm-hmm. Because most of the women are the ones who are preparing foods as well for their communities, and they need a lot of food to prepare this in the community canteens, because they are providing food for the communities. So we think that we can support that. We are supporting that actually currently, and as well as supporting the education and cultural devices that are already circulating, such as community radios and off-life school work. So material, didactical material to help them to buy them and to help them to care of the children at home as well. As well, we think that we should support the current strategies for prevention and attention to gender violence. So we need to support these circulating strategies, and as well as the production and commercialization of commercialization of social economy products. The production of the social economy, it helps to activate the economy as well. So we need that. This is fundamental to maintain the economic of the poorest neighborhoods and zones can be active in this moment. So this is the way that we think the cooperation could be could increase this capacity that all the society is trying to cope.
Yeah, and I think it's really interesting because it is not just a government, it's not just a government's role, but if you don't bring in civil society who is there, who is present, especially FBOs who are always there and they don't leave when the crisis is over, you miss you're myopic, you're missing a big element of the recovery. Celia?
Well, actually, if you're looking at the learning that we had from Congo in regards of the Ebola response, we saw that working with the faith leaders, working with local communities, faith-based organizations, the interfaith network, and the churches in Congo was the most important tool in regards of preventing and responding to Ebola and the spread of Ebola, because Ebola was spread because to a large degree of burial rituals that was done in the communities. And of course, the religious leaders are best placed in regards of providing information of alternative routines or alternatives for the different rite de passage that they can have when a person passes away. And in the same way, we are now engaging our faith networks in Congo to talk about hand hygiene and how COVID is spreading and not spreading, and how to share smaller households with a person that is infected compared to trying to prevent the infection of the remaining of the household members. And we do really see that it is the local communities, it is the local actors that are on the ground that can do the work, both in regards to prevention and response. Of course, it is the government and the health authorities' responsibility for the actual treatment of those that get very sick, but in the prevention work and ensuring that the right hand washing is happening and that we are preventing spread is really the work of faith-based organizations and local communities. And in the same way, when we are looking at the larger consequences and impact of the pandemic, such as the socioeconomic consequences, it is the local actors and it is the faith leaders that will remain in the communities that can help both preventing violence, but also can use the traditional birth attendants to prevent mother-child during deliveries of babies, that can support women and girls to come to clinics if they are pregnant, and that can provide information. Even during the Ebola outbreak, we can go house to house and provide information if you're not entering someone's house, but remaining within 2 to 3 to 4 meters outside to provide necessary information for survival of women and girls and men and boys. And it is very important. I believe that we are continuing to engage with the faith leaders, with the faith-based actors and the local communities on the ground, because that's where the difference is going to be, and that's the ones that has to rebuild their communities, both socioeconomically, ensuring education for children within the homes and returning to school. And of course, maybe some of these other impacts related to human trafficking, forced prostitution, can also be lessened and reduced if we are working comprehensively with communities to be able to support those that are most vulnerable. So I really believe in ACT Alliance and the work that we are trying to emphasize of working with the local actors and the faith-based actors within these kind of crises.
Yeah, Definitely, and it's also another, you mentioned the religious leaders and the role that they have in the community, and another role that they have is like reducing stigma, which is very important, because in a pandemic like this, it can be like it can be stigmatized instead of feeling that you need to help and you need to provide support. So that is another important element. So we're almost approaching the end of this chat, and I wanted to ask if you have any other comment or thought that you would like to leave our audience with. So it's up to you if you want to, or if you feel that you explored all the in this very short time.
No, for me, I really think that we have to come together as an alliance to work with the local actors and push governments to take in the responsibility of ensuring women and girls' rights, gender equality, and SRHR are included in the COVID-19 national response plans and local community response plans. If we're only treating this as a health pandemic, we are losing out on the on equality and on health SRHR rights for women and girls.
Thanks. Laura?
Yes, just say that we consider as ACT Alliance as well that we should support as well the diaconia departments of the churches. I think this is a key action to go ahead. And so, and as well, we think that there is the promotion of the awareness of joint responsibility in care is another strategy that can have a key role in this crisis. So the religious leaders has an important opportunity to help raise awareness of this reorganization of the care working. So it's an invitation that we can send that through channels such as of online preaching or virtual pastoralization, among other channels. Religious leader can as well help to put in balance this responsibility or joint responsibility in the families to help with these consequences of the isolations that has an impact in homes, at homes.
I like this very much, the joint responsibility, and I like ending with this. So thank you both very much. This was extremely instructive for me, and I hope it was also for those watching this video. Our next chat will be on the humanitarian challenges and opportunities and the impact of COVID-19 on refugees and people on the move. If you have questions that you would like to ask our experts in their next chats, please use Twitter, tag us ACT Alliance, and use the hashtag ActCovid19chat. Thank you very much. Thank you.
Thank you.